Hi everyone, my name is Hita, and today I will be presenting our work on explainable notes, examining how to unlock meaning in medical notes with interactivity and artificial intelligence. Perhaps you can recall a time when you visited your doctor and were inundated with a lot of information about various care recommendations and new prescriptions that were really hard to keep track of. This might have left you feeling confused about what actually happened during your appointment, whether you're on the same page as your doctor, and what your clinician is doing behind the scenes towards your care. In your patient portal, you have access to many medical documents that might help to answer these questions, including after-visit summaries, lab results, and medical progress notes. A progress note is a particularly useful healthcare document that records what took place during a patient encounter from the doctor's perspective. Progress notes often adhere to the SOAP format and include subjective observations of a patient's condition, such as their spoken observations of the symptoms they present with, objective measurements such as vitals and lab results, assessments of the patient's condition, and plans for how the patient's care should proceed. However, progress notes are historically written by clinicians to be read by other clinicians, and as a result might contain information irrelevant to the patient, specialized medical jargon that could be difficult to understand, and information that warrants contextualization or interpretation. In order to circumvent these issues, people might use AI to better understand their progress notes. Prior work notes that text simplification tasks using language models were largely seen as overall correct and complete. In this example, the text on the right-hand side is significantly simpler compared to the original report, while the original report on the left uses jargon such as radiography, MRI, sequencing techniques, and inversion-based fat suppression. The right-hand side defines these terms in simpler language. In an era where artificially intelligent systems are increasingly being used in healthcare, this paper asks what needs patients have when reading their medical progress notes, and explores the roles that intelligent interfaces should play in helping patients get the most out of their progress notes. Through a patient-centric qualitative study, we explored the aspects of the text that patients found difficult to engage with and potential improvements to the medical note reading experience. We conducted an observational study that consisted of 1-hour semi-structured interviews. Patients were first asked to read through a recent progress note from their own care history and speak aloud about the aspects of the text that they found difficult to engage with. And following this reading task, we spoke with patients about how to improve the reading experience, introducing mock-ups as probes to encourage reflection on concrete designs. This is an example of one of the mock-ups we showed patients following the observed reading task. Mock-ups were used to deepen our conversation of solutions and were developed for the following preliminary ideas: augmenting a note with an AI-generated summary, paraphrasing the passage, an AI-generated note in the margin explaining how a clinician arrived at a health assessment, an AI-generated explanation describing the significance of lab results that fell outside of normal ranges, margin notes showing excerpts of a patient-written testimonial, and messages of comfort from the clinician stating that the patient need not be worried about having a certain condition. 15 patients were recruited from a patient and family advisory council at the University of Pennsylvania healthcare system. Ages ranged between 23 and 84 years old, with a median age of 62. Patients were managing a wide variety of conditions within the specialties of pulmonology, cardiology, ophthalmology, and lymphology, among others. 8 patients were managing chronic conditions. 8 patients checked their notes. Most patients checked their notes on a monthly basis. And altogether, patients reported a relatively high degree of understanding their notes. Drawing together findings from this study, we articulate a vision of the explainable note, an intelligent, interactive note that provides integrated support on the basis of a patient's goals and knowledge. The main outcome of our study is a characterization of 3 needs that arise when patients read their notes and detailed observations of opportunities for how they can be effectively addressed. Our study describes issues of reading as relating not just to vocabulary and interpretation, but also in directing one's attention. Patients noted that they could use help finding the parts of the note that are relevant to them and skipping over the irrelevant parts. Most notes contained many passages like this. This passage was not particularly relevant to the patient reading it, particularly because some of these issues date many years prior and are no longer relevant to the patient. Some patients noted that there were pages of pasted content about their past medical history, copied from prior visits that spanned from weeks ago through about 8 years prior. Understandably, this information was often seen as too much. In this patient's words, "I don't need to know what my prescriptions are. I know that already. I don't want to be reminded of everything." To many patients, relevant information included lab and test results, assessments, and plans, and frequently irrelevant information included medication lists and past medical history. Patients envisioned reading experiences where irrelevant parts of the note were de-emphasized. This patient called for such information to be removed entirely from the note. Take out the medical history unless we discuss it. Take out the demographic information. I would expect the notes to be tailored to this exchange. They're not. Patients suggested ways of hiding irrelevant information that did not remove it completely from the document and could be accessed afterwards on demand. The most frequently reported impediment to reading was jargon. Patients desired support in understanding terminology-dense passages. Consider this patient's experience reading the following passage. In the patient's words, "I don't know what ileocecal valve is. I'll probably have to look that up. I don't really know what cryptitis is either. And at this point, I'm just like, whatever. I don't know what any of it means." One way to help patients cope with jargon is to eliminate it altogether by supplying patients with more readable summaries of their notes' contents. One patient shared that such explanations are particularly helpful when the jargon-dense information appears alarming. In their words, "By giving you more information in a readable format and not confusing you, it's going to at least calm me down so I can wait a few days and hopefully get to the doctor by the end of the week." Patients suggested ways of including more readable summaries of their notes' contents. Patients often felt that they did not understand the significance of information in their notes and desired interpretation and contextualization of the kinds that could only come from their clinicians. Patients often tried to reconcile results with what it meant for the severity of their condition. For example, this patient described finding a test result in their note that had been highlighted in their record, and so presumably had drawn the clinician's attention, but it had not been explained to them. In particular, a portion of the results for a slit lamp eye exam was highlighted in red, reading 2+ nuclear sclerosis. The patient states, "I want to know what the clinician is seeing and what it means. Is it something to watch out for? Is it something to get rid of? What does it mean to your future? And what is there to do about it?" Perhaps notes could be augmented in a way that integrate the interpretation that patients desired into the note. One patient described this vision of what such interpretation could look like. "This is what I want. I let the patient know she has this kind of cancer because her score is X. Her prognosis is Y. This is the treatment plan I'm recommending. I want a translation of what's next for me." In other words, the patient wanted a notably brief statement of the clinician's thought processes, connecting a test result to the prognosis and a set of next steps. In our paper, we identified 8 opportunities to address these needs, of which we've gone over 3: incorporating context-appropriate definitions of jargon, summarizing irrelevant or verbose sections of the note, emphasizing important information, subsequently de-emphasizing less important information, filling in the gaps with necessary interpretations, linking patients to providers with complementary perspectives, connecting patients with others experiencing similar health journeys, and incorporating comforting messages from clinicians in sections that might cause concern. Please refer to the paper for a more in-depth summary of these opportunities. Drawing on our findings, we see an opportunity to raise the profile of the progress note as the target of study within the HCI community. So what would it take to develop an explainable note? Firstly, similar studies with a broader population would expand the insights from our study. The effectiveness of explainable notes, like that of many other AI-assisted user interfaces, is limited by the accuracy of its underlying AI models. This warrants further investigation of AI improvements, including contextual definition generation, aspect-based text summarization, and tighter controls on hallucinations. There's also a need to design clinical and organizational practices for responsible authoring and safe reading of explainable notes. Please refer to our paper for a more in-depth overview of the affordances of the explainable note and the kinds of developments needed in HCI and AI to bring them out. Thank you.